Welcome to Behringer Talks, the show where we answer questions that you, our customer, have using our over 50 years of industry knowledge and expertise. I'm your host, Britt Hansen. Join us every Wednesday as we discuss a new topic about our devices, our company, and related clinical topics. Today, we're going to discuss the effect of canister placement on female external catheters. When using female external catheters, or FECs, such as PureWick and PrimaFit, the location of the suction canister is a crucial and often overlooked aspect of the clinical setup. Think of your suction regulator's pressure setting as horsepower. If you need to suction urine downward, you don't need much power, as gravity helps transport the urine. You'll find if you have the suction canister placed on the floor, your PureWick is much less likely to leak and will operate very well at low levels of pressure. Low pressure means better safety for your patients. Unfortunately, placing canisters on the floor is not a very practical strategy, as they are prone to get knocked over. Even worse, suction canisters are often mounted to the hospital's wall, well above the location of the PureWick or PrimaFit external female catheters. In this situation, gravity works against you because you are essentially trying to pull the fluid, quote, uphill. If you've ever seen a semi-truck driving uphill, this is the same effect. And you'll notice they require a lot of power and don't move very fast. As a rough rule of thumb, every foot of height takes 22 millimeters of mercury. So if you set a regulator to 40 millimeters of mercury, you won't even be able to get fluid to rise 2 feet. To compensate for the hardcore realities of gravity and physics, clinicians generally increase the suction. Turning the pressure higher on a suction regulator is the equivalent of a driver pressing harder on the gas pedal. Unfortunately, you can only increase the regulator's pressure so much before you begin putting your patient at risk of suction-related injuries. While there is no hard and fast rule on what suction pressure is too high for PureWick and other FECs, Behringer Laboratories doesn't recommend turning the pressure to greater than 65 millimeters of mercury. If you struggle with leakage or suction being set too high, look at your suction canister placement. A simple change in the location of your canister could make a big difference in the effectiveness of your PureWick or PrimaFit female external catheters. If you're looking for more information on solutions for clinical suction, be sure to check out Behringer suction regulators. If you have any questions about anything you've heard on our episode today, please visit us at BehringerLabs.com. Follow us on LinkedIn, Facebook, Twitter, and Instagram at Behringer Labs. That's BOEHRINGER Labs. Like what you hear? Subscribe to our podcast on Apple Podcasts, Spotify, or wherever you get your podcasts.